Hi, I'm Dr. Anil Kumar. I'm a consultant medical oncology and hematology working at People Tree Hospital. I treat patients with cancer. So October is celebrated as a breast cancer awareness month. So on this initiative, People Tree Hospital, we are sharing this short clip on educating the people about the breast cancer, the awareness about breast cancer and the treatment, the newer treatment, what are the latest advances. So today I'm going to talk about breast cancer. So normally breast cancer occurs in women who are 50 and above. So there are three reasons why somebody develops breast cancer. It is diet, lifestyle, habits and genetics. So diet is related to fatty food, alcohol, obesity, then habits being smoking, alcohol, and lifestyle being late pregnancies, not breastfeeding, any form of oral contraceptive pills or any form of hormonal manipulation done and treatments for infertility. So early menarche and late menopause, all these things would over time lead to a risk for breast cancer. So I explained diet, lifestyle and habits. So the breast cancer is the number one cancer for women coming from urban India. Now, as I told, all mainly because of a change in diet, lifestyle and habits. This would predict an individual to develop breast cancer as the age increases above 50. Now, there's something called genetics. So, where young women can develop breast cancer, even men can develop breast cancer. 1 to 5% of breast cancers can happen in men. So, this is something related more to hereditary. So when young people develop breast cancer, it is more aggressive type and you need some aggressive treatment. So now breast cancer, how do we diagnose it early? Now breast cancer generally can be picked up early by doing an annual mammogram. Mammogram is a simple x-ray of the breast. So once in a year, after the age of 45 years, all ladies should do mammogram up to the age of 60 years. So by doing this mammogram, you can pick up breast cancer early. But unfortunately, since we don't follow it uniformly throughout the country as a protocol or a policy, generally we tend to miss breast cancer early and people come in advanced stages. That is when the breast cancer has spread from the breast tissue to the armpit or the axilla. So it's already reached from first stage to second or third stage. So generally the diagnosis tends to be late in a developing country like India. So this is about diagnosis, early diagnosis. Now coming to treatment aspects. Now what are the treatment aspects? Surgery is the main modality of treatment for breast cancer. One is we do a breast conservation surgery, that is remove only the breast lump in the breast tissue. Then if you do only a lumpectomy or removal of the tumor, you have to compulsorily take radiotherapy after this surgery. The second surgery is mastectomy, where you remove the complete breast. So sometimes if the tumor is early stage, we could avoid giving radiotherapy if we do this kind of surgery. Now one I told about surgery, next thing is radiotherapy, I explained. Then based on the type of breast cancer, we decide on the chemotherapy so that whatever remaining cancer cells are there, they don't grow back and the cancer doesn't recur in near future. To prevent that, we give chemotherapy about 6 to 8 cycles, sometimes 4 to 6 or 4 to 8 cycles depending on the type and stage of cancer. Chemotherapy. There are newer drugs which have come into the market like Herceptin. So Herceptin acts on the HER2 positive cancer cells only. So the conventional side effects of chemotherapy are avoided in Herceptin, like hair loss, gastritis, mucositis, loose motions, all the bone marrow suppression. All these are side effects of a conventional chemotherapy or the older chemotherapeutic drugs. So this Herceptin goes and acts only on the HER2 positive cancer cells. So the other side effects are not there, only the very minimal side effects of Herceptin can happen. So this is one of the advantages. There are other drugs which have come up in the market like TDM1 and other drugs which are much more effective and the side effect profile is much better. These are the newer drugs. Then coming to diagnosis, we have latest technologies. We have PET CT scans which can pick up the stage of the breast cancer early. So So by doing which we can stage the cancer, and on follow-up also we can use the PET-CT scan for staging. Thank you very much. Today hopefully I raised an awareness on breast cancer to all the viewers, and also a little bit of I educated you on the breast cancer diagnosis, the screening of breast cancer, why we have to do mammogram, and the treatment for breast cancer, and how by taking a combined modality of treatment like doing surgery, chemotherapy and radiotherapy, the risk of breast cancer recurring in near future can be reduced. Thank you.